The difference between stage 3 and stage 4 is that the cancer is beginning to spread to distant organs. So when you carry an NLS device and your device is already detecting additional cancers apart from adenocarcinoma of mammary gland, that's a secondary cancer case and it's on account of a spread, then you know that this is stage 4. The common symptoms the person that is suspected to have breast cancer may experience, maybe you first of all you discover a breast lump, then you now discover a change in breast shape, then nipple discharge or skin dimpling. Now when you see one or two of these, it doesn't automatically mean that you have cancer. That's why it's important for you to now run a scan, probably with the NLS device or whatever, to check whether there is tumor present and if it is malignant. Another type is lung cancer. The common symptoms of lung cancer, you will see the likes of persistent cough, chest pain, shortness of breath, or person coughing blood. Today, I want to show you how to use your NLS device to detect various stages of cancer. I know you'll be surprised to know that you can use your NLS device to detect various stages of cancers, whether it's stage 1, stage 2, stage 3, stage 4. Now, when I'm talking about NLS device, I'm referring to your biofilter tracker, your Meta Hunter, your 19D, your 17D, your 9D, your bioplasm, and the likes. You can actually use these devices to predict stages of cancer. But you may not appreciate this video if you do not know the basics of NLS device. If you don't know how to consult with the device, you may not appreciate what I'm about to share with you. That's why I want to encourage you to enroll for my online masterclass course in the NLS device and Meta Hunter, or if you have the biofilter tracker device, enroll for my online masterclass course on the biofilter tracker device, and then you appreciate what I'm about to share with you. I also have other courses that you will benefit from. If you don't have the NLS device, but you have the QRMA device, I've recorded amazing videos, over 200 videos of over 30 reports on the QRMA device. In fact, I even have in that same course video how to detect 25 common diseases with your QRMA device that you may not be aware of. So you need to also enroll for my online masterclass course on the QRMA device if that is what you have. And I also have the natural medicine online masterclass course. Now, if you are into healthcare, you need basics of natural medicine. And we also have basics of biochemistry, basics of human anatomy, basics of medical lab science. You need some of this basic knowledge to become an effective consultant. In that course, you also find how to interpret laboratory reports. When you see lab reports, even as a natural medicine consultant, you need to know how to interpret results. All this you will find in that course. So it's a course that you need to go for. What is cancer? Cancer is a disease that is characterized by the uncontrolled growth of abnormal cells in the human body. Normally, cells grow, divide, and die in an organized way. But in cancer cases, damaged or abnormal cells keep multiplying, and this multiplication of cells end up forming the mass that we call tumor. This tumor may be malignant or it may be benign. But if it is malignant, then we are talking about cancer. Cancers are categorized into two, which include solid tumors or blood cancers. Solid tumors can be divided into what we call either carcinomas or sarcomas. When we are talking of carcinomas, we are referring to cancers that has happened or that occurred in tissues or major organs of the body, like cancer of the lung, cancer of the breast, cancer of the kidney, cancer of the liver. Those are carcinomas. But if you're talking about sarcomas, we are talking about cancers that occurred at connective tissues and bones. Those are examples of sarcomas. Then the second category of cancer is what we call the blood cancer. This type of cancer affects the immune cells. Now, when it comes to blood cancer, they are divided into the leukemia or lymphomas. When it comes to leukemia, this kind of cancer originates from the bone marrow. You know, that's where we have the T cells originating from before they migrate to the sternum for training and so on. Then when it comes to leukemia, this kind of cancer originates from the lymph nodes where we have the B lymphocytes. When doctors diagnose cancer, they classify them into stages according to how far they have spread. And they use what we call the TNM guide to predict each of these stages. Speaking of TNM guide, T stands for tumor. Okay, you want to check the size of the tumor, the presence of a tumor, all right, to determine if there is cancer present or not. Then N stands for node, talking about the lymphatic node. We are speaking of it spreading to the neighboring lymphatic node region. That you use that to categorize what stage the cancer is. Then M stands for metastasis, speaking of the spread of this cancer to distant organs. Now let's start with the initial stage. Now when it comes to clinical stage, they are categorized into 5. We have stage 0, stage 1, stage 2, stage 3, stage 4. There are other sets that merge stage 0 and stage 1 and just call it stage 1 to stage 4. Stage 0 is also referred to as carcinoma in situ. This kind of scan, whether in the lab or with NLS device, is trying to detect or predict whether abnormal cells are present. Our case study today is going to be on cancer of the breast. So you want to check whether it is reading adenocarcinoma of mammary gland. When you see the word carcinoma, it's talking about cancer with your NLS device. I'm giving you some information free that you will see in my training. All right, I'm just giving you free knowledge. So in stage 0, the scan is to check for presence of carcinoma, but this carcinoma has not spread to the neighboring tissues or neighboring organs. For stage 2, this kind of scan is trying to check for small localized tumor. Usually in this kind of case, the tumor is confined to the tissue of origin, the original place. If we are talking about cancer of the breast, we will discover that it is just at a particular spot. It has not spread to the neighboring tissue, it has not spread to the neighboring lymph node. Now, here's the pattern of carcinomas. When they begin to spread, the first place they will go to is the lymph node and the neighboring tissues. So, in stage 1, it has not spread to the lymph node. Once it has not spread to the lymph node, then you know that you are dealing with a stage 1 cancer, which is a good place for you to do something about it when it comes to treatment. Stage 1, small localized tumor that has not spread to neighboring lymph, neighboring tissues. For stage 2, when you do a scan with your NLS device or a scan in the lab, you will discover larger tumor sizes. How will you find larger tumor sizes with the NLS device? You will need to engage the tools of the evaluation button and the localize button. If you don't know how to manipulate the evaluation button or the localize button, enroll for my online masterclass in NLS device or Biophilia Tracker, Meta Hunter, and you are going to learn how to engage the localize button and the evaluate button to predict the size of the tumor. In stage 2, we are looking at a larger size of tumor. Then you are also observing a limited spread to the neighboring tissue or nearby lymph node. So take for example, our case study today is cancer of the breast. So this is the breast. It means that if you are using an NLS device to scan, you are scanning the left brachium, that's the upper left arm. And when you scan this area, engaging the localize button, and you evaluate this area and scan that segment alone, you may see adenocarcinoma of mammary gland in certain areas, but not the entire brachium. The main thing here is larger size of tumor, possible limited spread of adenocarcinoma to the neighboring tissue. Now, what are the neighboring tissues of the breast? You are looking at the skin, or you are looking at it spreading the chest wall of the skin. So this is the breast, and it is spread to just a few portions of the chest wall of the breast. Then you are going to be suspecting that this is in stage 2. When it comes to stage 3, we are looking at a larger than stage 2 size of tumor and an extensive spread to the nearby tissues and the lymph node. So if you localize or cut a segment of the lymph node, you will see that the spread is bigger. It has covered more areas of the lymph node compared to the stage 2 that have just covered only a limited section of the lymph node. And when it comes to the chest wall, when it comes to the skin of the breast, you discover that it has spread to virtually almost the entire region of the breast. Then we are looking at a stage 3. But it has not spread to distant organ. That's the difference between that and a stage 4. Then the last stage is called the metastatic cancer. This is the stage where the cancer is not only spreading to neighboring tissues and lymph nodes, it is spreading to distant organs. So take for example, our case study is cancer of the breast. Then when the cancer of the breast begins to spread to the liver, to the kidney, to the lungs, then we are looking at stage 4 cancer of the breast. Now, even in this particular stage, you will now also observe secondary cancer. So you will now discover that your scan is no longer only detecting adenocarcinoma of mammary gland. You may now see that it's also detecting adenocarcinoma of lungs, adenocarcinoma, or it may be adenocarcinoma of kidney, or adenocarcinoma of the liver. Distant organs, maybe in the bone, sarcoma of the bone. That is stage 4. That is secondary cancer that arose on account of the primary case, which was adenocarcinoma of mammary gland. So in stage 4, difference between stage 3 and stage 4 is that the cancer is beginning to spread to distant organs. So when you carry an NLS device and your device is already detecting additional cancers apart from adenocarcinoma of mammary gland, that's a secondary cancer case and it's on account of a spread, then you know that this is stage 4. Now, knowing all these stages gives us wisdom on our manner of approach when it comes to treatment, so that you have to be aggressive at this stage to combine several therapies in order to rescue the patient. But one thing I want you to note is that cancer is not a death sentence. You can actually recover from cancer if you follow protocols correctly in order to stop this uncontrolled spread of malignant cells. So this is where we have to stop it for today. So once again, I encourage you to go and subscribe for my online masterclass course in the NLS device, Meta Hunter device, my online masterclass course in the biofilter tracker, my online masterclass course on the QRMA device, or my online masterclass course in natural medicine. You will have a bonus package of lifetime coaching once you enroll and you watch the videos. See you in my next video.